In GMP, the most effective way to protect product quality and patient safety is to prevent problems before they occur. Risk-based thinking supports this by encouraging teams to look ahead, identify where issues are more likely to arise, and apply the right level of control early. Without risk-based thinking, quality systems might respond only after a problem has already occurred. By applying risk-based thinking in daily processes, teams are encouraged to ask key questions earlier, before issues develop or escalate. Examples of these actions can include the following: reviewing processes and procedures before they are used in practice, identifying steps where mistakes are more likely to occur, applying additional checks or controls to high-risk activities, and addressing small issues early before they lead to deviations. This preventive mindset forms the foundation of many GMP processes. They support consistent decision-making, reduce unnecessary disruption, and help teams maintain control as conditions, tasks, and situations change.